Welcome to True Out Tuesday, and the truth will set you free. Okay, it's kind of cool. Okay, there's like a delay here. Um, yes, this is the first time I've ever done this. Okay, we're going to start off with a few questions. I've got some from YouTube's that we don't answer, but there's a couple on here that I cannot answer. It's about the current medical procedure that's forced on most everyone that's actually being investigated now by a lot of countries. So we can't answer those. Don't you love censorship? You know, what a great way to take over a country. But this one, what is the best diet for multiple sclerosis and the best supplements? And also with this help with nystagmus. Nystagmus is absolutely, it's a shaking the eyeballs, okay? And it's, you're going to see that's an upper motor neuron lesion thing. So the way to correct MS is by restoring the nerve supply. Now, one of the things in MS, they're going to say, well, don't exercise. But if you look at it, it's not a demyelinating nerve condition. Okay, this is why 80 to 90% are remitting and relapsing. So, you know, you don't have the myelin sheath restore, then the myelin sheath break down, then it restores again. So you got to look at brain function. Ketogenic diets are fantastic for every type of seizure, every type of brain dysfunction. It's fantastic. But look at healing the gut. So it's not just one supplement. You don't want to get one supplement for thyroid, one supplement for multiple sclerosis. No, you've got to look at, because that's an allopathetic move where you're doing the supplement for a symptom instead of looking that most of these conditions are an adaptation to deficiency or toxicity. And this is what it is. So you've got to heal the gut up, get the nutrients we're looking at, and look at the physical, chemical, and emotional stressors that are contributing factors. So the supplements, ketogenic diet would be helpful, okay? But also minerals. Without minerals, you can't utilize vitamins, and plant-based minerals are the key. So you need a plant that draws the copper, selenium, zinc, 125 minerals out of the soil in order to utilize that, except when you're talking about brain issues, you're talking that person is in a chronic sympathetic dominant state. So imagine if you had the greatest healthy fats, the greatest minerals, everything, but you're standing on that person's feet while you're giving it to them. Okay, they're going to be in a stress state and not be able to absorb it. So look at the physical, chemical, emotional stressors, heal the gut, and then you're going to be able to get the absorption. Because no matter what supplement you're using, what type of diet you're using, you have to get that person out of that fight or flight state because you have the automatic nervous system. One part keeps you alive under stress, the other part regenerates tissue. You got to have a balance of that autonomic system. Now, okay, I've got this one here too. This is from Ricardo Lizardi. It was on the celiac disease and bowel disorders. They blocked your videos. I have to look for them if the videos don't show in my favorites. Yeah, the shadow ban blocked. We're trying to get on every platform there is. Do me a favor, click, subscribe, share all the stuff we got. Let's blow it up, okay? And they're either going to kick us off, which I'll see you on the Dr. BVIP, Extreme Health Academy, BitChute, Rumble, all the other places we're at. But, you know, just click, subscribe, share, and say, look, let's just screw around with this. Okay. Yeah, I'm not being nice now to them. Okay, now, this is from Robert Bond. I don't have a long distance plan, but can someone ask if he does stem cells for the eyes? Stem cells are fantastic, and where we get them, there's three different areas. One from the bone marrow, one from the fat cells, one from umbilical cords of women that have not been shot. Okay, and so we're looking, the umbilical cord ones are fantastic because it's held in Wharton's jelly, which is chondroitin and hyaluronic acid. So it's incredible. But first, before you do any stem cells, and you're talking to a guy that's this is our clinic, okay, the stem cell clinic. until you fix the problem. Okay, it's not like a miracle cure, so like if you have some kind of issue with the eye, generally it's because the eye is not moving. And if you're just staring at a computer screen, you're not getting the muscles on the outside of the eye to increase or decrease the tone. So the vitreous humor, it doesn't get that good fluid transfer. So you've got to work the eye, make sure that you've got healthy digestion, make sure they got healthy movements, you got healthy vitreous humor production. And then it's like any joint in the body. I don't recommend shooting any joint in the body, knees, feet, hips, any of that, until you fix the actual problem. Okay. Then when you fix the problem, then the stem cells might not even be necessary. But if they are, fantastic or fantastic. Yeah. Yeah. It works incredibly good. Now, YouTube be hating. I like that. I like the back to the basics. Okay. Now, what causes an infected gallbladder? And this is from Eric Deutsch. This one's on Facebook. Infected gallbladders. When you look at what the gallbladder does, it stores and concentrates bile. Where does the bile come from? It's made by the liver. Where does the liver get it? You got the spleen, and the spleen, it checks every red blood cell. And red blood cells only last about 120 days. And any red blood cell that's near the end or is damaged, the spleen sends it over to the liver. The liver breaks it down into the blood proteins, creates bile, and then the bile is stored and concentrated in the gallbladder. So the duodenum, which is the area of the intestines right past the stomach, as soon as fat hits that area, there's sensors that cause the gallbladder to excrete and forces that bile in there to emulsify the fat so that you can get the fatty acids and build the hormones. Fantastic. Problem is, the gallbladder and the pancreas drain through the same opening. And do you remember the mnemonic doc? It's the ampulla of Vater. Okay, I would say it's the amphitheater of Vater. This is where the pancreas and the gallbladder hang out. Okay, that way you'll remember it. Okay, the weirder the thing, you remember it. Okay, but the gall, the fluid in there, the bile, can get thick. Okay, because stress hormones actually increase the viscosity of that fluid. And under physical, chemical, or emotional stress, the stress hormones, epinephrine, norepinephrine, cortisol, are excreted throughout the body, and there's no off button. Once they're used up, they're sent to the spleen, over to the liver, same way as all the blood pathways, and they get broken down. And this is when you look at gallstones and slice them open, they're literally the crystalline formation of the stress hormones. So the reason, I mean, it's a long answer to what causes gallbladder infections. Stress is going to increase the stress on the gallbladder because it's literally forming and concentrating it. Now, if that gallbladder goes to contract to get rid of that bile and there's stones or sludge or anything else, it's going to work and it's going to be hard to do that. So that's going to create damage to the tissue. Damage to the tissue is what's called inflammation. Okay, and inflammation is going to be a repair process. So I doubt if it's going to be a gallbladder infection. Gallbladder inflammation, though, is super, super common, and that's in chronic stress. So there's actually soft tissue adjustments that you can do to de-stress out that that gallbladder area, where you can actually get rid of the gallbladder sludge. You can move the soft tissue around, de-stress out, look at the physical, chemical, emotional stress, and the gallbladder will start working. Vitiligo. How do I feel about red light therapy for vitiligo? Absolutely fantastic. Okay, if you're looking at the red light, I mean the Juve light is excellent. That's infrared as well as ultraviolet. The flex beam is fantastic as well. But no matter what you do to the skin, particularly for vitiligo, you got to heal the gut. Okay, the gut is the tissue production area, so this is huge. And then you got to restore the nerve supply to that area. And I'm pretty familiar with vitiligo because my wife did 20 years of nonsteroidal anti-inflammatories and antibiotics for ulcerative colitis, and that destroyed her skin. And now her skin's looking pretty good. But that's been stem cells, vampire stem cells, facials. It's been red light, and it's been 10 years of healing the gut. So that's a big deal. Now, Um, okay, I'm curious about detoxing my liver, kidneys. I don't know where to start. And this is from Back to the Basics. Should I start with a colon cleanse and go from there? Liver and kidneys, those are both blood filters. Anything that you put in your mouth has to be filtered through the liver. So your diet should be like your great great grandparents. But remember what they were like? Okay, only organic, only seasonal, only healthy, just the same way that the 10,000 generations that preceded you ate. Okay, they ate like normal food, not the crap that we got. So the liver is going to be taxed from any kind of medication. Now, the liver and gallbladder flush is nice, but if you're in a stress state, the blood becomes thick and then it taxes the kidneys. And this is if you're just watching a scary movie, the blood viscosity increases. So the kidneys got to work harder. And if you have these two little fists that are the size of the kidneys, and you got to get 6 quarts of blood going through there about every 20 minutes, okay, and the blood becomes thicker, guess what has to happen to blood pressure? I know it's the clue. Okay, I'm everybody. Gee, I don't know. Okay, this means it goes up. Okay, so because it's thick, it's like pushing a malt through a straw. So the look at the physical, chemical, emotional stress before you do a kidney flush or liver flush or look at the blood filtration. That's huge. Get up to 2 to 3 bowel movements a day because when you're looking at the liver, kidneys, also look at the lungs. You got 4 detoxing pathways in the human body. You've got respiration, perspiration, pooping, and peeping. Okay, so you cannot do a liver flush unless you get up to 2 to 3 healthy bowel movements a day. When you're looking at the kidneys, that's a blood filter. Okay, and under chronic stress, the kidneys got to work a hell of a lot harder. So look at the physical stress, get digital x-rays of the whole body. This is going to clue you in that there may be an unstable pelvis, forward head carriage, deviation of the rib cage, something. Okay, because if you are not looking at the physical, chemical, or emotional stressors and you just want to clean the filtration system, guess what? It's going to get clogged again. Okay, so you got to look at the underlying problem. Then look at sleep patterns. Sleep is when the body regenerates. And I know it sounds strange, but every time we get a patient, we do look at the entire structure with digital x-rays. Then we check the nervous system with 3 different scans. Then we do a live blood cell analysis and we do a full body thermography. And we use all that data to identify the physical, chemical, and emotional stressors. Then what's wild is 30 adjustments later, we do all the other tests, the same test to see that we've corrected the problem. I know. Does that make sense to everybody here? I know, because I think everybody here is a patient. So, yeah. They're going, duh. Okay. But you got to find somebody that's going to address the underlying stressors. Then, okay, so you've addressed the underlying stressors. You got a liver and kidney that you want to get cleaned. But I'm saying you got to look at the liver, the kidney, the lungs, okay, and the digestive tract. So you've got to get 3 bowel movements a day. So you got 3 bowel movements a day, you're sleeping good, you've looked at the physical stressors, okay, you're doing the neurolinguistic programming to take care of the emotional stressors so the blood's viscosity starts to normalize. You're dealing with the 4 stressors, beautiful. Then a liver flush is good. But I would recommend the liver flush doing colonic hydration, at least 3 of them in a week. So you do 1 colonic Monday, and make sure you're on doing juicing, fasting, super healthy diet. Colonic on a Wednesday, okay, juicing, fasting the whole week. So this is going to be cleansing everything. And then you're going to have another clinic or a colonic scheduled on Friday, but Thursday night you drink a cup of grapefruit juice, a cup of olive oil, chill it, because it sounds gross. Does it sound gross? It's not as bad as what you would think. I've done it a few times, and it's slimy, but not as gross as what you would think. Okay, so you down this cup of olive oil and grapefruit juice. You can't mix it; it just like floats all over the place. And then sleep on your right side so you can increase the pressure there. And then in the morning, now that you got good gastric motility, get the 3rd colonic, and that it just flushes you out fantastically well. The kidneys actually clean up really nicely utilizing apple juice. The malic acid dissolves the stone. It also helps de-stress out the gallstones as well. So we recommend 4 juices when you're doing a detox. Apples have malic acid, and I'm talking juice in the core as well. Carrots have beta carotene, which helps clean the lungs, and the lungs are another blood filter. I know. So when you're going, not only is carbon dioxide in your system alkalinizing, you're doing a hell of a lot of waste products. Yes, I know it would be stupid to cover your face and rebreathe it in. That would weaken the immune system. God, some people are just friggin' know-it-alls. Okay, yes, breathing outside is normal for human beings. Okay, so then you've got perspiration. So if you don't have access to a sauna, get magnesium oil spray, put it on your chest and tummy, sleep in towels so you can develop a fever. Okay, and that works really, really well. It's poor man's sauna. Don't knock it. Okay. I'm the youngest of 4 kids raised by a single mom. Okay. I can stretch a dollar till George screams. Okay, so the poor man's sauna works, and then diaphragmatic breathing works. Okay, so just in through the nose, out through the mouth. That's going to de-stress out the system. We just had an 87-year-old gal who had a port in her chest for dialysis. And I mean, her daughter was, just protecting her like crazy. But it took us about a month and a half, and now she's no longer on dialysis, and they removed the port. So that's cool. I know it takes a long time to answer some of the questions. Okay, now Bell's palsy, John Lantos from YouTube. 4 years later, face is back, but the lip has remained dropped. The nerve is not responding to the mending. Okay, Bell's palsy, 100% of the time, and this is the most irritating thing I've ever heard, is it takes years to recover. No, it doesn't. Okay, you're looking at the location of it is huge. You're talking Bell's palsy means half the face is dropping down. Okay, you can have nerve damage from certain medical procedures, but generally it's coming from the upper thoracic area and upper cervical spine. And this is why you have tearing, you have sweating on one side, and half the face isn't moving. So there's 3 stressors. I know you're going to hear me say this a whole bunch because you got to address all 3. You got to figure these things are not symptoms of lack of vitamins. Okay, they're adaptations to physical, chemical, and emotional stress. So when you're looking at Bell's palsy, you got to look at all 3 of them. Number 1, you got to look at the upper thoracic area because you're looking at an autonomic dysfunction. And there's the same thing for reflex sympathetic dystrophy. That means when you grab something hot or cold, okay, your hand is either going to turn blue or red because the blood vessels are constricting or dilating. So all those automatic nervous system dysfunctions, they call it autonomic dysfunction. You got to look at the source of the autonomics. I know. There's a naturopath in the front row, there's a doctor in the second row, and they're going, duh. Thank you. Go a little slower. I know. Okay. So when you look at this autonomic dysfunction, you should look at the autonomics. And so you're looking at the upper cervical spine. So you got to do a digital x-ray of both. You got to do a stress x-ray and correct the problem. And you'll see the Bell's palsy actually go away. But could these people also have a gut issue? Yes or yes? Absolutely. Because if they're in a chronic state of stress, they're going to have a leaky gut, decreased blood supply to it. A chronic stress state, they're not going to be able to absorb nutrients. So you got to look at the gut. So, and since the second half of the parasympathetic nervous system, the rest, digest, and repair, is located in the pelvis and in the neck, okay, should you look at the pelvis? Oh my gosh. This is why when we get people in here that have had Bell palsy for like 8, 9 years, it hasn't been more in like 3, 4 months that we have somebody that's got that condition. So it's like, why don't you just freaking fix it? But you can't look at this as the problem. This is the end result of a physical, chemical, and emotional stressors. Now, this one, okay, good. Here's one. Injections. Wait a second. Boy, have you ever tried to look at something and then all of a sudden somebody puts something on there and it goes? Okay, acid reflux. Um, okay. God, this is not as easy as what you would think, is it? Okay. I've been to two different chiropractors from Sharon H. I have pain on the right side of my body, back and shoulders, hip, knee, when bending, and the lateral side of my foot. What's causing this? Pinch nerve. Next. No, no. I mean, you got to figure that, and this is the weird thing with pain. Doctors today are completely ignorant. They're looking that pain is actually a good clue to how the body is functioning. And just think of the guy, healthy, happy, playing fun, golfing all day Sunday, dies of a heart attack Monday. Okay. 10% of the nerves that come off the spine carry pain fibers, 90% don't. So if you're using, okay, good, I don't hurt today, I must be okay, that's insane. These clues, okay, and this is pain here, pain there, pain everywhere. Okay, there's going to be some kind of clue to a problem. And there's three stressors you have to look at to find the source of the problem. Now, I could just be ignorant and say, well, just look at the physical stressors. Get stress x-rays of the low back, static x-rays, look at the entire structure. But if somebody has had a structural problem for a month, okay, or for a year, or for 20 years, do they have a normal, healthy, automatic nervous system balance, or are they in a stress state? They're in a stress state. So if they have this pain everywhere, I'll say, first thing, kick off your shoes, okay? And they'll look at me like, no, it's the pain's up here. Okay, well, if they've been in a chronic stress state and they have a pelvis issue or some type, how do you think their sleep patterns are going to be? Good or poor? Poor. That's how the body regenerates at nighttime. Digestion. Do you think they're going to have 2 to 3 healthy bowel movements a day, or one? One, if they're lucky. They're going to say, oh my God, one if I get lucky. Okay, so poor sleep patterns, one bowel movement a day, and this is why the doctors cannot be concerned with the symptom of the moment. You've got to look at the physiology of the person, how they're regenerating and how they're not regenerating. But we're living in the dumbest society, and the medical authorities are worse than the Spanish Inquisition. Okay, that they're looking for symptoms. Like, we have a workman's compensation thing in California that is literally Dumb and Dumber would be smarter than these guys. Okay, no, just think, if you have somebody with a hurt ankle at work, okay, is that hurt ankle going to cause their gait to be a little off? Yes or yes? Okay, do you think that might destabilize the pelvis? Yeah, if they're walking crooked for a while. But no, no, no. The doctor can't look at the pelvis because they just hurt the ankle. So that's the only area they're going to take an x-ray of. That's the only area they're going to look at. If that pelvis is unstable, they're going to have unhealthy bowel movements. Yeah, but they're not going to look at that. Now, if you're walking like this, do you think that could negatively affect the upper rib cage area or shoulder? Of course. So it's called holistic, to look at the whole body. But anything other than looking at the whole body is incredibly stupid. Yes.
From Dr. Jeffrey Knight, from Robert. Thanks for consistent teaching, work, and go.
Oh, okay. So we got on the Dr. BVIP. That's one I don't have. From Robert, for consistent for education. Okay, one of the things, and this is tough, the greatest book in the world is the Anatomy and Physiology coloring book. I taught doctorate level board exams through that area to educate them. And you don't need to color it, because I wasn't good at coloring. Don't give me shit. Okay, staying in between the lines is hard. Okay. Okay, I've been able to do that since third grade anyway. But it's brilliant because you got the pictures and then you got the words on the other side, so you can check it. So self-study with that is fantastic. We also have an apprenticeship program that I think we've done like 4 or 5 of them. The last one we did last week was on genetic and genetic expression. So we're tying in everything in that. But there's not many courses that you could take. There's 86% of the chiropractic universities are being taken over by the big pharma anyway. So you're not going to get a good education in schools. And if anybody in here remembers what it was like to be in school, their health class, their social studies, everything. They're learning a completely different world than what I learned. Okay, I mean, it's just unusual. But look for private studies. Look for people that you respect. Okay, and take their courses. Like we've got a blood pressure course, sleep course, the apprenticeship course. Look for somebody that has good ideas and learn from them. And there's also why we have a clinic in Mexico, a clinic, a Thailand I go to a few times a year to educate people over there, because I can't say I'm adjusting people because it's not legal to adjust people over there. So we're educating forcefully. Um, no, I'm just reading between the lines, man. Okay, so it's find somebody and keep learning, but have this to be your whole life. Because even doctors, they've spent years and years and years of education. And this is doctors in naturopathy, homeopaths, the ones that are indoctrinated in the pharmaceutical, regime. Keep learning. There is a commencement speech, okay, but I forget the name of the doctor, but he said, and it was at a medical school, pretty high-end medical school. He says, everything that you're learning now, 50% within 5 years will be proven wrong or out of date. The problem is we don't know which half, okay? And if anyone's been aware of the 3-year propaganda mission that's been going on, no, I know, it's 2 weeks to flatten the curve. Okay, 3 years of propaganda, okay, you can understand that the medical system is completely dysfunctional. Now, I need to sleep. This is from Andre Ritter. Barb, can you re-ask my question? It's just so many people are putting questions. It's hard to read this. There. Okay. Okay. Acid reflux, eliminate belly fat, massage, move, eat less portion control, check gluten, alcohol, and other acidic foods. This is from Danza. Not really. Okay, because when you're talking acid reflux, if that's what the point of it is, because some people are answering other people's questions on this, so this is not. It's a lot harder than what I thought. You've got a muscle on top of the stomach called the lower esophageal sphincter. When there's acid present inside of the stomach, this muscle tightens up. So when the stomach starts sloshing around, the acid won't come up into the esophagus, and then you won't get that burn. Problem is the stomach is on the underside of the diaphragm. Now, the only thing that pierces the diaphragm that connects to the stomach is the esophagus. Now, if the diaphragm, which the nerve that supplies the diaphragm, comes out of the neck, and I know what you're going to say, C3, C4, C5 keeps you alive. I know. She pays attention. There's always one of these in class. Irritating. But if you have a lower neck problem, guess what? That diaphragm isn't going to be healthy, and that stomach can start to pooch up inside of that pleural cavity. Now, this is where the heart is and the lungs are. That's why they call hiatal hernias the great mimicker, because you can get heart stuff, lung stuff, a bunch of stuff from that weakened diaphragm. So what do you have to do to correct acid reflux? Number one, check the nerve supply to the diaphragm. Number two, look at the stress state, because if you're producing less stomach acid, then that lower esophageal sphincter won't be tightening up, keep the food contents inside of the stomach. Another is to eliminate drinking water during meals, okay? Because anything that dilutes the stomach acid loosens up that lower esophageal sphincter. And this is why God put the nose over the mouth, because when you bring something up here, you smell it so you can recognize that, and then instantly your stomach starts to produce a certain acid for it. So if it's broccoli or lamb or chicken, it's going to be 3 different acids. So no water before. There's you got to check the nerve to the diaphragm, which is going to come out of the neck, and then you can do soft tissue adjustment. But when you're looking at belly fat comes from cortisol production, and that's belly, seat, and thighs. So this person would be under chronic stress. So look at physical, chemical, and emotional stress. And that will help all three of those, and it will help appropriate amounts of stomach acid. This is why when people have reflux, the number one thing is to bentane hydrochloric acid would be okay, but for no more than a month, as long as you're addressing the underlying stressors. Now, okay. From D.E. Pratner, grandfather lost bone in his mouth and is now experiencing trigeminal neuralgia. Please advise. That's from D.E. Prather. The tough with damage, and this has to do with healthy dental stuff. And this is, again, why we have a dental clinic that does Huggins protocol in Mexico. When you remove a tooth in this country, pretty much they'll pull a tooth, give you a pain reliever, and that's it. That can leave the ligament in place and create a subclinical infection called a cavitation. And a lot of people are going to old school dentistry where they just pull the teeth if they're starting to rot. And then that leaves the cavitations underneath, which can actually eat away the bone. So the way a tooth has got to be pulled, okay, you pull the tooth, okay, and this has to do with root canals, which are actually dead teeth in the mouth. Those eventually are going to cause an issue. The only way to identify if a root canal is causing an issue is by doing a thermography, and then that way you see if there's an area of increased temperature. So if you have a root canal or two root canals, don't run out of the, particularly if you saw the movie The Root Cause, don't run out screaming, holding your mouth, saying, I'm going to die. Okay, get a thermography. You're going to see a hot spot there, and a hot spot generally on the right chest, which is where the lymph drains. And then you know that it's an issue. But when you're removing a tooth or a root canal or anything else, that's got to come out. Then you got to go in with a totally different operation and remove the ligament. Then you take the patient's blood, spin it down a plasma cell, inject the openings so the bone regenerates. Then you treat that with ozone, and then that whole process is done while the patient has a vitamin C IV. That's best in the world. Best in the world. That's what we do down in TJ. For grandpa, look at vibration. A trigeminal neuralgia isn't going to be coming from the bone loss. It's going to be coming from the TMJ and from the upper cervical. And trigeminal neuralgia is correctable. And this is another one, it's like Bell's palsy. Trigeminal neuralgia, by correcting the upper cervical, so you need specific upper cervical techniques on chiropractic adjustments. You need specific techniques to adjust the TMJ, temporal mandibular joint, because this joint is hugely important, hugely complex. When you open the first 15 degrees, the pivot point, the jaw opens. After 15 degrees, it literally falls out of the socket and there's a floating disc that gets in there. Now you've got a hard bone here. And if you're resting on this cheekbone, the zygomatic process, no problem. If you're studying or your hand's here, you're moving the jaw over. So just this is good, this is bad. Or you can have trauma. Okay. Like most men have here, if you're not listening, okay. Totally kidding. No, girls don't hit the guys. It's not good. Okay. Okay, guys can't hit girls. That's what I've been raised with. So, and you're raised with guys can hit guys. That's your profession, brother. Okay, but just know that TMJ could have trauma, not necessarily from a fight, but it could be from altered biomechanics of somebody just resting like this or resting like this. And so that jaw, you have to work the capsule, you got to work the masseter, you got to work the temporalis. I mean, the TMJ is really, really complex. And so you got to find somebody that knows how to fix it. And, that's one of the courses I taught. So it's kind of like, I'm the quiet kid in the back that you says, TMJ, yeah, I can fix that. I know that one. Please pick me, Yes, sir.
Read Dr. John Bergman. He's like a yellow square.
Yellow square. Oh, YouTube. Okay. Oh, yeah. from Sylvia. Is it possible to chelate bone, probably spurs that are profuse in my congenitally narrowing spinal column? My cord is said to be 5.5 millimeters and is compressed and is causing much pain. Okay, good, good, good. Oh, this is ideal. Okay, one of the things when you're talking bone spurs, and this drives me freaking crazy. And I've got a patient now that I haven't met. I just talked to on the phone, and the MRI says bone spurs. Okay, bone spurs. Okay, think of this. Is the body smart or smart? Okay, good, good. So let's just settle that now. Bone spurs are not going to grow off into the canal, choking off the spinal cord. The central nervous system is primary to everything. It controls and coordinates every function of the body. What happens though is you got a vertebrae here, a vertebrae here, and they're separated by a disc. Now, the body gets its strength from the curves. So you have to have a curve this way, and a curve this way. If you're missing those curves, that causes a narrowing of the spinal canal where the cord is. And that's spinal stenosis. That's all it means, narrowing. Now, how do you correct the stenosis? You restore the curves and regenerate the discs. And this is going to, so many doctors out there are going to go, no, you can't regenerate the disc. Yeah, because if your primary therapy is giving someone a non-steroidal anti-inflammatory like Advil, Motrin, Aleve, or the one that they don't even know about, like Paracetamol, okay, that also has those type of properties where it destroys the building block of cartilage. So if you're taking those drugs and you're a doctor, you're giving them to the patients, you're never, ever, ever going to see discs regenerate. So here's the scenario how bone spurs form. The trauma first, that locks in the muscles. The discs have a horrible blood supply. They get their nutrients through imbibition or through movement. This is why you can restore movement, and then the blood supply, nerves, starts to fill up because the discs are about 70% fluid, and then it starts to regenerate. But if you have a trauma locking in the muscles, decreasing the motion, the disc gets compressed, and that becomes unstable. It's supposed to be here, stable. Here, it's unstable. So the body increases the surface area in between the two vertebrae, and that's what the bone spurs look like. Okay, it's literally on the top and bottom of the vertebrae that are forming to stabilize that area. So it's from a trauma first, long-term trauma never addressed, then the body forms this to increase the surface area between the two vertebrae. Now, today, just had another patient, okay, and we'll see this all the time, where we literally show a bone spur and then 30 adjustments, 60 adjustments for sure, you're going to see it, but you're going to start to see the bone spurs get resorbed in the body as you increase the surface area or increase that disc surface. And then the more stability occurs at the joint by restoring the curve and realigning the vertebrae, then there's less abnormal force loading on it. So you get more appropriate movement. More appropriate movement means more appropriate nutrients going to the joint. And then the bone spurs are not needed. And through Wolff's Law, bones lay down where it's needed, resorb where it's not. The bone spurs literally are resorbed in the body. They're not needed. I mean, that's fantastic. So you got to correct the stenosis. That means restore the curve. Now, here's the weird thing. To regenerate the disc, you have to create inflammation. I know. Right now, there's about 10 people here going, oh, God, that's so dangerous. No, inflammation is the healing process of the body. Everybody knows this. Okay, inflammation can create free radicals, which can damage healthy tissue. This is why the anti-inflammatories of like vitamin C, omega-3s, blueberries, those all deactivate the free radicals and make inflammation work. So this, Sylvia, not only is it possible, but you can identify if it is correctable by doing a static and a stress x-ray. This means, let's say you're taking the neck, for example, as it could be the mid-thoracic area, which is the toughest area when you're going to get a disc. Hopefully it's a cervical disc or a lumbar disc. Thoracic discs are a bear. They're not fun for me to fix. It's just a pain in the butt. But luckily, the rib cage is really hard to cause a disc injury because you got 12 ribs on either side that's designed for protection. But you get a static x-ray and a stress x-ray to see if the joints are moving. In the lumbar, we'll do a static x-ray and bend to one side and bend to the other side. And I mean, we're bending hard. Okay. But you can't. Once that pelvis recruits, you got to stop it. So you're isolating that lumbar, isolating the cervical spine, or isolating the thoracic spine in order to see if there's movement. If there's movement, that's gold. You're good to go. You can regenerate the joint. If there's not movement, and this is for all the doctors out there, if you do a static and a stress x-ray and you see there's not movement, and I have been wrong, I'm telling you, probably 15 times so far in the last 20 something years, 27 years, when I told him that it was fused and it wasn't. Okay. It's like I've got this one patient now who is just adorable. She reminds me of my sister. Okay, and she has a vertebrae that weren't square. One of them fused. It just didn't grow right. It's called a hemivertebrae. You see them all the time, with what I do. And I thought it wasn't moving at all. Week into care, the thing's moving, and it's like, God, I love being wrong. We can restore this. So it's like, my ears go back, tail wags. I'm happier than heck. Yes, sir. Facebook, right away, sir. I've got 2 guys back there that are way more skilled at this than I am. So they're telling me what to do. Which way do I go? Down? Okay. Okay, yeah. Yeah, that's it. Okay. Any tips for what I can, this is from Melissa Webb. Any tips on what I can do for my 14-year-old son? He seems to have a growth or polyps in his nose causing trouble breathing through the nose and sinuses, to have problems on and off. It first happened when we had lots of fires in California and the air quality was terrible. Yeah, absolutely. When you're looking at polyps, that has to do with weakened or irritated tissue area. It's kind of like, not really like a callus, but it's going to be some type of irritant in the nose. So he could be blowing it, rubbing it, or anything else. But if there's a sensitization to particulate matter, it has to do with a hypersensitization. And this is what all allergies are. The problem is, the allergies in kids, okay, now are completely different than the allergies in kids 40 years ago. Okay. Because what an allergy is an abnormal recognition of a foreign protein. And for a foreign protein to get into the bloodstream, and that means a foreign protein is not tempered by digestion, means you got to have a leaky gut, okay? Or you're getting some type of medical procedure that's putting foreign proteins inside of the bloodstream. Now currently we can't talk about those. And in fact, if we did, they'd wipe out our channel. We're already in jail, okay? YouTube jail, Facebook jail, all the other jails. Okay, so there's certain medical procedures that inject foreign proteins into the system. And so this has a hypersensitization. Like, does anybody in here remember the 7th inning stretch? Take me out to the ball game, buy me some peanuts. How dare you say that? There's peanut-free days now. If you have a peanut in the stadium, people can die of anaphylactic shock. So how did people go from eating peanuts regular to, oh my God, I'm so allergic to nuts? Because certain medical procedures are suspended in peanut oil. And if you're getting that foreign protein injected into the system, you're going to hypersensitize these people. So if he's been raised with certain medical procedures that can cause that, we have to desensitize the system. And there's ways to do that. But also, we have to get the nose, the polyps in there, healthy. And one of the ways to do it is look at the blood supply and nerve supply. Typically in kids, and he's 14 years old, what we would ask, did he have ear infections as a kid? And guess what most parents will say? Oh, not many, just 2 or 3. That should be the biggest red light that comes on, because an ear infection, 97% of the times in children, is not an ear infection, it's an ear effusion, which means like if you just swallow like that, you can hear a popping in your ear. What you're doing is you're opening up the eustachian tube, and that means you're flexing the soft palate. In a birth trauma where the kid was pulled out or forceps or had the cord wrapped around the neck or the mom got Pitocin, all of those things that are commonly done in hospitals can traumatize that kid's neck. And that can alter how the soft palate flexes. And then the kid's ear will fill up with fluid and they'll tug on it. And a well meaning, well loving pediatrician, but ignorant, will look in that ear, not ask about the birth trauma, see it red and bulging and hurting. And so he'll give him an antibiotic, which destroys the gut flora and has no bearing on correcting this. And then, and then that'll suppress it a little bit, then it'll come back, then another round of antibiotics, then it suppresses it a little bit, then it comes back, and then they put ear tubes in. I mean, I see this scenario all the time. It drives me nuts. So look at the birth trauma, look at history of ear infections, look at history of antibiotic use, because those are all poisonous molds. Then we got to restore the polyps or restore the nerve supply to the sinus area. If he's had chronic sinusitis, the facial bones actually move. So we have to get in there and move the facial bones, okay? And that's going to restore part of the nerve supply. Sometimes you got to go in the mouth and open up the maxillary, and that has a huge effect on the sinuses. Moving the skull bones is also going to be important. But healing the gut, that's tissue production, is going to be extremely important in these kids. So you need to get an x-ray to find out what the heck is wrong, to find out if there's a problem with the upper cervical, gut area, lumbar. Facial adjustments are going to help. Healing the leaky gut, if you find that. Desensitizing the system, particularly if they have allergies or asthma. And this has to do with slowly introducing whatever they're allergic to in very, very tiny amounts. It's like if you had a jungle disease and were allergic to penicillin, and if you don't get penicillin, you're going to die. It takes around 48 hours to get over a penicillin allergy by giving slowly increasing doses of it. So you can desensitize the system from allergies under the direction of a competent naturopath, chiropractor, somebody that really knows what the heck they're talking about. And then that is going to help with the nose. It's going to help with the polyps. Polyps will just start to go away once you restore the health of the nerve supply and the tissue. Yeah, did you have another one? Oh, yes, sir. Oh, the bottom of the comments. Oh, that's under the Dr. GB? Okay, this is from Stuart. I'm a certified reflexologist, and I'm interested in becoming an osteopath. What is your opinion of osteopath's effectiveness? And I'm a patient of an osteopath, and it has worked wonders for me. The old school osteopaths are freaking amazing. It was started by Dr. Still in 1895, who was a Civil War physician that would not tolerate a pill, potion, or lotion put in his patients because he knew that the drugs that were given back then were incredibly toxic, harmful, and didn't help. And he had a theory of restoring the blood supply and restoring the normal body's function. So they do a thing called manipulation. Chiropractic was started in the same year, 1895, and we do adjustments. So we work mainly with the nervous system. He works with manipulating, mobilizing, and restoring the blood. Way better than applying drugs. Okay, traditional osteopathy is fantastic. The problem is most of the osteopaths don't practice it anymore. Okay, and they do prescribe medications, and it's beyond stupid to give a medication which decreases a metabolic response. And I'm talking a non-steroidal anti-inflammatory, ibuprofen, Motrin, Aleve, okay, that destroys the building block of cartilage. Or to give a medication, a chemical. This is our society. You're given a chemical that's poisonous to the body to alter their physiology, to alter their adaptations to stress. I mean, in 100 years from now, they're going to think that is the dumbest thing you could possibly do. The right drug at the right time and the right doses, minimum kills 130,000 people a year. So if you're talking that type of osteopathy, don't freaking do it. Okay, if you're going to be completely drugless, like Still did, Dr. Still that started it, man, it's one of the best things around. I'd really promote you to be a chiropractor instead. But man, if you got an old school osteopath, but getting through that education is hard because the osteopathic schools have been taken over by the pharmaceutical industry. And there's certain hamstrung things. I mean, in California, we now have a law that says doctors can't really express their opinion on certain subjects to patients, otherwise they'll lose their license. And there's certain standards of care that medical doctors have to follow, otherwise they can lose their license in every state. And it's like a few years ago, they had a standard of care where if somebody wasn't getting an aspirin, okay, if they had elevations in blood pressure or aspirin and cholesterol, that wasn't considered the standards of care. I have no idea what the drug protocol is now for the standards of care, but you may be locked into that. And there's certain doctors that are being independent, following their heart, their education, their mind, and they're following protocols that they have dealt with in clinic, and that is where science is. Okay, it's not put up by pharmaceutical reps inside of the hospitals that are looking to prescribe multiple drugs to everybody in an assisted living center so they can all make a piece of the action. Okay, you need somebody to actually find the problem and correct it. And I know this is going to be a shocker, but I have not seen anyone suffering from a lack of drugs yet. I mean, and the average person is taking what? It's over 60, 12 different prescriptions. I know 14 would make them healthy, but it's just foolishness. So osteopathy, traditional, dude, awesome. Go for it. If it's like modern, hell no. We're good? Okay, good. Then, okay, here we go. Cheyenne Bodine had a total left hip replacement that failed. I need the right one done, but I didn't follow through. I take vitamins and I need advice on cartilage. I have none. I doubt if you don't have cartilage. Okay, now this is what we see, and it's only about 100%. Well, so far it's been 100% of the time. When people come in with a hip, a knee, shoulder, or joints in the spine, my doctor said it's bone on bone. Okay, just doesn't work. It makes noise every time I move it. Okay. No, I'm telling you, if you stand and you sit, that knee is bending or the hip is bending 90 degrees. If you're walking around with a peg leg, yeah, it may be fused, but I haven't seen that yet. I have seen thousands of people with joints that were told that they're fused and they're not. So you look at, particularly since you've already had a hip done, look at stabilizing the pelvis, because that's one of the biggest contributing factors. When you're walking around with an unstable hip, or they go in there, do an operation and replace the hip, okay, then you're talking that pelvis is completely unstable. So a trochanter support will be ideal. Stretch the calf and the knees. That's going to be ideal. You're going to have lumbar disc injuries that are associated with that. And you could have a total thoracic area that's laterally shifted that's affecting it. So anytime you get a hip problem, you have to look at the whole body. It's called holistic, but it's just common sense, because you can't have a body that's shifted off to the side from some past trauma, have a completely abnormal force loading on the pelvis, and think, well, yeah, I'm going to fix the pelvis and not correct anything, and then it'll be just fine. I don't know why I keep using that voice for stupid doctors, but it makes sense to me. If you've watched enough Simpsons like I have, it would make sense to you as well. But it's stabilizing the pelvis, fixing the whole body, and then it actually works. So I would hold off on getting the right hip done. Find the problem, fix everything that's broken, get you out of the stress state so your body can regenerate tissue, and then you got a chance to regenerate it. I mean, once you correct the problem, and I'm talking the whole friggin' problem, that means the calf biomechanics, the knee biomechanics, the pelvis biomechanics, then you can think about stem cell injections or PRP. But I wouldn't do that right away. You got to fix everything first. Okay, does that make sense? It should. Now, what time is it? 5 more minutes? Okay, good. 5 more minutes. Okay. Oh, this is also from Cheyenne Bodine. I lost all my cartilage secondary to deadly brain pituitary tumor. How does one rebuild cartilage in all the joints? Look at the physical, chemical, emotional stress. When you're in a chronic state of stress, okay, your body has less stomach acid and you can't get the amino acids from the proteins. So look at bone broth, look at this, but you got to address the underlying stressors. When you're talking a pituitary tumor, the pituitary is controlled by the hypothalamus. The hypothalamus is controlled by the information coming up from the spine. So look at the entire control mechanisms. It's not just that tumor in the pituitary. That's not going to be from a trauma, but it can be from a trauma getting abnormal stimulus to the hypothalamus, and that could be a contributing factor. But look at the underlying stressors. Pink Owl said my shoulder video saved him. Okay, that's cool. I like that. Oh, good. If you have time, can you touch on what to do for people that suffer from almost daily panic attacks? Yes! Okay. No, we got to look. I know there's 3 people just jumped up. And I know I'm going to get deep shit trouble because I shouldn't be yelling because people just like ears blew out. Okay, but let's go on this. Anxiety, stress, depression, impulse control, schizophrenia, bipolar disorder are all features of the frontal lobe. Now, the frontal lobe is programmed by the cerebellum, the little brain in the back. So if you've had any kind of physical trauma in the past, you're getting abnormal stimulation of this little brain in the back, the cerebellum, and that controls the frontal lobe. So body posture is the key. Then you got to look at neurotransmitters production. They call it the gut-brain connection. Okay, so look at healthy gut function, healthy bowel function. And what does that take? You've got the automatic nervous system. If you're in a chronic state of stress, you're in a chronic sympathetic dominant state. So there's physical, chemical, and emotional stressors that you got to deal with. Physical stress, look at digital x-rays, stress x-rays, identify the stressors. That's one. Chemical stress, poor sleep patterns is going to be the biggest contributing factor, and poor diet. Okay, because the gut, it's called a gut-brain connection. If you have a poor gut, leaky flora, you're not going to be producing the healthy neurotransmitters that you should be. Then look at how the brain is working. Okay, the brain is going to be firing appropriately based on your perception of the environment. Okay, so if you're perceiving that it's a dangerous environment, your brain is going to be in a chronic fight or flight state so that you can run away from danger and you're going to be ready. Okay, you're always going to be ready. Okay, which is great for battle. Like if you go into 1918, south of France, the Somme, okay, and test everyone there, bombs going off, they can't sleep really good at night. Okay, they're going to be in a chronic fight or flight state, and that keeps them alive. I mean, they're not going to be up there, smoking a cigarette waiting for the bullet to whiz by their head. Okay, they're going to be in a panic state that keeps them alive. So understand that panic state is a defense mechanism based on your perception of the environment. Now, once you heal the gut, once you change the sleep patterns, once you correct the stressors, the physical stressors, now you got to reprogram the subconscious. And there's about 3 or 4 methods to do that. The one I like is neurolinguistic programming, the I am exercise. And this is where you body posture, volume, intonation, and breathing. You don't have to believe this stuff, so you can feel like crap warmed over. And you're saying, I'm healthy, I'm dynamic, I'm vibrant, I'm strong, I'm healed. That repetition, because that's how the subconscious, that's how that frontal lobe learns, not through belief, but through repetition. Okay, that's one. The other one is EMDR, eye movement desensitization response. That's what they use in the military to help people get over post-traumatic stress disorder. There's emotional freedom technique, which will tap, okay? And then that changes how the brain works as well. Just know there's so many methods out there. And it's literally, if you master your emotions, you change your physiology. And you can master your emotions by taking charge of it. Just think like if we're in a car, because when you're talking anxiety, stress, things like that. Let's say we're in a car and we're going to a relative's house that you don't like. I know nobody in here has a relative they don't like. Am I the only one? Okay. So you're going to this relative's house and you're thinking, okay, they said this and I'm going to say this and they're going to say this. Okay. You're building this up and you're emotionally and chemically living that event inside of your body. And it's a delusion. We're in the car. Okay, you're just driving. So the key with thought firing patterns, because one thought will hit another thought, will hit another thought, and those thoughts can suck you into the pit of hell. And so once you recognize those patterns, you think, oh man, I'm in that old firing pattern, which kept me alive in the war. Now we got to change that. Okay, that's why I cannot let my emotions happen by chance. When I'm driving in that car, okay, my truck, and I'm driving to a patient, employee, project, business, whatever I'm going to. Okay, if I let my thoughts fall at random, man, those will suck you down. Okay, so when I catch my brain firing along those random patterns, I think, ah, shit, I'm back in that old pattern again. I'm healthy, I'm dynamic, I'm vibrant, I'm strong, I'm healed. I'm connected to the healing source of energy. God's love flows from God through me into my patients. 100% of the people I touch receive that healing energy. Over and over and over. I get out of that truck, I'm vibrating at a higher level. Man, problems will bounce off of me like bullets off of Superman. Yeah, but it's not, you're not going to learn it in a week. It's over and over and over. The greatest skill you can develop is recognize those thought firing patterns and master your emotions. Just like those, the yogi guys that can raise or lower their blood pressure, hold breath for crazy amounts of time. You master your emotions, you change your physiology. Yep. Okay, well, this was actually really fun. It was suggested by my son who's in Poland, about a quarter mile off of the Czech border in south of Poland. So God bless him. Thank you, Michael. I love you, buddy. Okay. And what I liked it. Did you guys find it interesting? Yeah. Okay. Cool. Because I wanted, because I'm going to be in Thailand in the next like 2.5 weeks, and so we won't. But next week we're going to have a True Health Tuesday, and the next couple of weeks after that, I'm probably going to have to do it online. Okay, but I don't know how we're going to have to do the questions and answers, because like 7 o'clock here would be like 8 o'clock in the morning, and I'm already going to be working, or not working, but talking to people aggressively with both hands. Yeah. No. Yeah, because you can't do this stuff now. Okay, so but if I do it at like noon at lunchtime down there, it's going to be a little different. So I may find some way that you guys can submit questions, maybe submit questions on this, and we'll do it. You guys are the experts. These guys know everything about the internet. They'll tell me how to do it. Okay. So if you're on YouTube, Facebook, and Dr. B, God bless you all. That was fun.